Hello, Mr. Dials.
Hi.
Let me rub in my stuff. How are you today?
I'm doing well.
Good. My name's Runa, and I'm going to be your nurse today. We're going to do a cardiac assessment, a little bit of respiratory. And to get started, I'm going to ask you a few questions, okay?
Okay.
Can you tell me your full name and date of birth?
Jason Caleb Dials, 6/17/95.
Okay, very good. Do you have any allergies?
No, ma'am.
Okay. Do you have any cardiac history, any cardiac diagnosis in the past?
Nope.
Okay. Do you have hypertension, high blood pressure?
Nope.
Do you have high cholesterol?
Nope.
No. Do you take any medications?
None at all.
Wonderful. So you're healthy. Okay. So we're going to get started. I have a few other questions. Do you drink alcohol?
No.
No. Do you do drugs?
No.
No. Do you use tobacco?
Yes.
What kind?
Smokeless.
You dip snuff?
Yep.
How much snuff do you dip?
About a can a week.
Oh, okay. 1 can a week. Okay. Well, first what I'm going to do, I'm going to do a few things, actually. I'm going to look you over. I'm going to listen with my stethoscope. I'm going to palpate and, touch on you. Do I have your permission to do this assessment?
Yes.
Okay. All right. Well, first I'm going to take my pen light and I'm just going to look in your eyes, look at your face, look in your mouth. Okay. Can you open your mouth for me? Stick out your tongue. Lift up your tongue. Okay. Very good. All right. I'm going to be looking here at your jugular veins. I'm looking for a jugular vein pulsation here, and I see it. I'm also going to feel it. Okay, on the other side. Okay. Jugular vein pulse noted, and no JVD, no jugular vein extension. I'm going to also just be taking a look at your chest here. Pull your shirt down here, just to make sure that your chest is even. Also, too, I'm just going to be palpating your heartbeat, okay? Okay. All right. If you don't mind now, I'll take a listen to your heart. There's a couple different places that I'll put my stethoscope. We're going to start. You want to sit up a little? Okay. We're going to start here on your right. We're going to listen at the second intercostal space for your aortic valve. Can you take a deep breath? Hold it. Okay, I'm going to flip my stethoscope over to the valve. Okay, I hear your S1 and your S2 beat. No murmurs, no extra beats, no extra sounds. We're going to move over to your second intercostal space here and listen to your pulmonic valve. I hear your S1, S2. Hear no murmurs, no extra sounds. Okay, we're going to move down to the intercostal space 3. We're going to be listening at Erb's point. I hear S1, S2, no murmurs, no extra sounds. Okay. We're going to be moving to intercostal space 4, to the mitral valve. I'm sorry, to the tricuspid valve, I'm sorry. S1, S2. No murmurs, no extra sounds. And lastly, we're going to be moving to mid-clavicular line to listen for your mitral valve. I'm also going to feel your carotids while I'm listening. See that they correlate. And is there any way you can lay down that way on your left side? Put your feet up here. And I'm going to take a listen here to your mitral valve. S1 and S2. Don't hear any murmurs, no extra sounds. Okay, you can sit back up for me. Okay, now while you're up and I have my ears on, I'm going to listen to your lungs. You do have a heart rate of 66, which is normal sinus rhythm. So that's good. That means you have a regular heartbeat and a regular rate. Okay, so I'm going to listen to your lungs now. Here in the back. Take a deep breath for me. Let it out. In. Out. In. Out. In. Out. Okay. And I'm going to be listening up here. In. Out. One more time. In. In, out, in, out. One more time. In, out. Okay. All right. I'm also going to take a listen to your carotid arteries with my stethoscope. Hold your breath. Okay. Let it out. One more time. Okay. Listen to this side. Okay. All right. Let it out. Okay. All right. Your breath sounds were clear. Upper, middle, right middle, and lower lobes, both anteriorly and posteriorly. You have no heart murmurs that I heard. I didn't hear any extra heart sounds. I didn't hear any murmurs. So it sounds like you have a really healthy heart. I also felt here earlier to make sure that I didn't feel a thrill or a swooshing of blood as I moved my hands around. And now I'm going to I'm going to feel for your pulses. Can you show me your hands? Alright, I'm just going to be testing for your to make sure that there's no clubbing on your fingers or splinter hemorrhages. I'm looking at your blood return in your fingers, and that comes back within a second or two. Okay? Can you do this for me? Put your fingers together for me. Okay. clubbing there. Okay, I'm going to feel your radial pulses here. Okay, you hold your arms out for me. I'm going to also feel your brachial pulses. Both +3s in both of those areas. Okay. If you'll lay down for me here. Now I'm going to be feeling the pulses in your legs. Here at the groin area, it's called a femoral pulse. I'm going to palpate both sides. I feel +3 pulses bilaterally. I'm also going to feel behind your knees for, it's called a popliteal pulse. Okay. I'm just going to watch your leg. Feel +2 pulses bilaterally. I'm going to feel here at your tibial pulses. +3s bilaterally. And I'm going to feel for your pedal pulses. +2s bilaterally. I'm also going to look at your toenails. The blood return back to your toenails. About 1 to 2 seconds. Also, too, when I look at your legs, I'm looking for any swelling at your ankles or your calves. I don't see any swelling anywhere on the legs. They also feel warm. Looking at the pattern of your hair on your legs, and there's no missing hair, there's no brown spots, and they're both warm to the touch. Let's see, I believe that will conclude our cardiac exam or cardiac assessment today, and I thank you for taking the time with me, Mr. Dials. And you have a good day.
You too.
Okay. Stop.